Hey, what's up folks? Welcome back to Intuition. Today is another pharmacy video for you guys. We're going to be answering questions on solutions in healthcare. There are definitely some solutions out there that you should be familiar with and know how they are utilized in healthcare. So we're going to answer 3 questions that should give us some good practice on familiarizing ourselves with different solutions. So let's dive into it. Question number 1. Question number 1 says, a fungal infection is suspected for a patient who has skin discoloration on his back. The physician scrapes the discolored area and dissolves the skin cells in a solution before looking at them through a microscope. What solution was most likely used to dissolve the cells? We have to be familiar with what's going on here. This patient has some skin discoloration on his back, and the physician thinks that it is a fungal infection, so she scrapes the area and takes the debris and dissolves it in a certain solution. Now, what solution would this be? The solution is going to be potassium hydroxide, and you might wonder why such a harsh chemical. Some skin cells will be taken off the patient's back, as well as some fungal cells. And the potassium hydroxide is such a harsh solution that it's going to kill the skin cells. The fungal cells tend to be more resilient and are able to survive in a very basic environment. So that is why potassium hydroxide will be the solution of choice when it comes to this type of diagnostic test. Okay, so the correct answer to this question is potassium hydroxide. Hopefully that makes sense. All right, let's go on to question number 2. Question number 2 says, a patient undergoing septic shock would most likely be given a bolus of which of the following solutions before receiving norepinephrine? Another straightforward question where we have a patient undergoing septic shock. So this basically means that the patient's blood pressure has dropped significantly. So what do we do to help get a patient out of shock? This question says that we're going to be giving the patient norepinephrine. And what will that do? Norepinephrine is a vasopressor, right? So this is a drug that squeezes the blood vessels of the body to increase the blood pressure. When this drug constricts the blood vessels, that's going to cause the blood vessels to squeeze on the blood that is inside. But you have to remember, there has to be sufficient fluid inside the blood vessels for the blood vessels to squeeze on. So for this question, we're going to give the patient a solution to make sure that there's sufficient fluid inside the blood vessels. And you definitely want to give a fluid that's going to be isotonic with blood. And that's going to be normal saline. A bolus of normal saline to make sure that there's sufficient fluid inside the blood vessels before giving the norepinephrine, which is going to constrict the blood vessels against the fluid. Okay, so the correct answer is going to be answer choice D, normal saline. Okay, let's go on to question number 3. Our third question says, a solution loaded with DNA polymerase enzymes and nucleotides is most likely reserved for which of the following? Okay, so we're talking about another solution here, and it has DNA polymerase, which is an enzyme. And this enzyme is responsible for the replication of DNA. And nucleotides are the building blocks of DNA. So once we know that, we immediately know that this solution is going to be designed to help replicate DNA. We replicate DNA to amplify the DNA of a certain organism so that we can detect it. And the type of test that allows us to identify a certain organism is a PCR test, which stands for polymerase chain reaction. So the correct answer will be answer choice A, a PCR test. All right, so there you have it. Let me know if that was helpful. If you enjoyed the video, go ahead and give it a like. If you're new to this channel, go ahead and hit the subscribe button. We're happy to have you here on Intuition, where we focus on concepts and understanding instead of memorizing. So go ahead and like, share, and subscribe and become part of our family. And with that said, I'll see you guys in the next one. All right, bye-bye.